Hello my lovelies, my name is Stephanie Lynnette and I may contain trans fats, and welcome to my lovely candy cane coated, very queer, very trans corner of the internet. And today, here on this very queer and very candy cane coated corner of the internet, we're going to be talking all about different varieties of lower feminizing surgery, which is a gender affirmation surgery pathway specifically for individuals who would like to become more feminine within themselves, and also for AMAP people who would like a either more feminine or more gender neutral kind of androgynous genitalia zone. So in today's video, I'm going to be talking about surgeries that are most commonly referred to as lower feminizing surgeries. And lower feminizing surgeries aren't exclusive to trans women or people who want to have a feminine kind of genitalia experience. They also extend into the non-binary and gender expansive communities for people who maybe don't want a feminine appearance but don't want masculine genitalia. So there are often some kind of segues and blurred lines and things like that, but I'm going to be breaking down different types of lower feminizing surgery. This video kind of came about because I recently put up on my channel a video about the fact that I'm 5 years post-op. Yay! But it became apparent in my comment section, to me anyway, maybe not to you, it became apparent in my comment section that lots of people, one, didn't know what type of surgery I had had, despite the fact that I had disclaimed it multiple times, and two, didn't know the variety of things that were available to trans and gender expansive individuals who were going through gender affirmation surgery and gender affirmation care. So that's what I want to talk about on my channel today. But before we get started, I just wanted to take a moment to put a little bit of a disclaimer here. I'm not a doctor, I'm not a surgeon, I'm not a nurse. I do work within trans healthcare, and I work within a field that specifically is dedicated to helping to support trans people going through gender affirmation surgery pathways, and I work specifically with patients who are going through lower feminizing surgery, but I am not a doctor. So all of this is very kind of colloquial information, but it just became obvious that lots of people maybe don't know the difference or don't know what's available to them in kind of layman's terms. So I thought we'd do a video just kind of breaking down different things, different bits and bobs, different kind of surgical procedures that you can have done. Okay, so lower feminizing surgery refers to a group of surgeries or individual surgeries that you can have primarily to alleviate gender dysphoria. However, lots of these surgeries were developed initially for cisgendered women who were either born without vaginal canals or had various issues, or as the result of trauma, or had kind of imperfections that they wanted to have treated. So these surgeries were actually originally developed for cisgendered people, although some of them were also originally developed for the trans community specifically, but lots of them are used across both the trans and the cisgendered community for repairing trauma, helping to install vaginal canals if people don't have vaginal canals and things like that. So in this video, we're going to be breaking down 3 different surgeries. We're going to be breaking down an orchiectomy, a vulvoplasty, and a vaginoplasty. These are the kind of the 3 primary surgeries. Some of them are often combined. So like if you're having a vaginoplasty, you would have an orchiectomy as well as a vulvoplasty and things like that. And so those are the 3 pathways we're going to be breaking down. However, it's important to mention that some trans individuals and gender expansive individuals who were assigned male at birth will have a penectomy without having any form of surgery. And a penectomy is the removal of the penis tissue, the shortening of the urethra. Usually it retains some of the penile glands, which is obviously the head of the penis. And a penectomy just kind of removes the shaft of the penis, and it's used not just in trans people, it's primarily used in cisgendered men actually, and can often be used to help kind of remedy cancer and things like that. But we're not going to be breaking down a penectomy today. I just wanted to mention that I hadn't forgot it. It wasn't part of this. It wasn't part of what we're doing here today. Okay, so first up is an orchiectomy, sometimes referred to by certain people as an orchidectomy, but an orchiectomy is the removal of the testicles from the body. And the way that that procedure works, you can have it with or without scrotum removal. Most people prefer it without scrotal removal so that they can retain the skin for a later surgery, because this is a surgery that you can have before you have a vaginoplasty to have the testicles removed. So usually how this surgery works is an incision is made through the center of the scrotum, and then what happens is the spermatic cord is stitched just to prevent kind of heavy bleeding and the testicles are removed. And some people choose to have this surgery just on its own because they don't feel particularly dysphoric about having a penis. They don't really care about having a penis, but what they do care about is the testosterone that's produced by their penis, is the kind of sex drive that comes along with that. So an orchiectomy really helps to alleviate gender dysphoria because it removes a very high percentage of the testosterone in anyone who is AMAB, assigned male at birth, and that can really help to alleviate gender dysphoria. Some people choose to have an orchiectomy and that's it. Most people I know choose to have an orchiectomy with the kind of viewpoint of eventually having a vaginoplasty or a vulvoplasty, but that is how an orchiectomy works. It's the removal of the testicles and the optional removal or non-removal of the scrotum. Okay, so next up is a vulvoplasty, and a vulvoplasty is specifically for people who want to have a gender affirming surgery but don't necessarily want to have penetrative sex. It's not part of their priority. I know lots of people who have had a vulvoplasty. I considered having a vulvoplasty for a little bit of a while, and essentially what it is, it's they remove the penis, they retain the glands in the urethra, and what happens is they remove the penis, kind of the body of the penis, and then they remove the testicles, so an orchiectomy in kind of combination. And what happens is they utilize the skin from the scrotum and they use the skin from the urethra, which is shortened during the surgery, to create the labia minora, the labia majora, the pubis mons, and they don't create a vaginal canal. So what happens is at the end of this surgery, what a patient is left with is a clitoris, which is made from the glands of the penis, which has been relocated to just above the urethral opening, and then they're left with a urethra as well, a shortened urethra, and then obviously they have their labia minora, majora, mons pubis, and this is for people who, like I said, specifically don't want to have a neovaginal canal. This is for people who don't want the stress of kind of recovering from a vaginoplasty, because there's a huge amount of dilation and work that goes into recovering from that. So yeah, for some people a vulvoplasty is utilised for those reasons, but it's also utilised in cisgendered women for reconstruction, for aesthetic purposes. And I suppose it's really important to kind of mention here that I'll be using the word like neo-vulva, neo-vagina. So essentially in medicine, the word neo comes from the Greek neos, which means new, young, recent, and it's used as a prefix, and you'll hear it a lot in the trans community. So like if you're assigned female at birth and you're going to have a phalloplasty, they create a neo-phallus. It just means a new phallus or a recent phallus, and so a neo-vulva or a neo-vagina is a new vulva or a new vagina. My vagina is 5 years old, in case you didn't see that video, and you know, if you haven't, rude, I'm gonna link it above my head so you can go and watch it. But I kind of refer to my vagina as a neo-vagina because it still feels quite, I guess, new, but it's not technically new anymore, so I could just call it a vagina. It's kind of that thing of like, all thumbs are fingers, but not all fingers are thumbs. So like, all vaginas are vaginas, but not all vaginas are neo-vaginas. So a neo-vagina is still a vagina, just like a trans woman is still a woman, but not all vaginas can be neo-vaginas, because we're special. Oh yeah. And so a vulvoplasty is often, well, I say often, almost always used in collaboration with an orchiectomy to remove the testicles. So that's a vulvoplasty, and that's why we use the word neo in front of vagina and vulva. There you go. Okay, and last but absolutely not least, we're going to go into vaginoplasty. So a vaginoplasty is combining elements of the vulvoplasty but creating a vaginal canal. And essentially there are various different versions of a vaginoplasty. I'm going to break down the 4 kind of most referenced ones for you. I know some about some of them and a lot more about others because of my kind of personal lived experience. So I'm going to list them from least knowledgeable to most knowledgeable, and that also happens to correlate from least used to most used. So yeah, we're going to break it down in terms of the different types of vaginoplasty. So first up, we're going to be talking about a jejunum vaginoplasty. The jejunum is the second part of the small intestine, and essentially what happens is a surgeon will go in and remove a small section of the second part of the small intestine, the jejunum, and they will graft it to make the neovaginal canal in between the bladder and the rectum. This is one that I know the least about. This is one that is not commonly practiced at any of the areas that I specifically kind of know of and have researched in my kind of past experience and for this video. But it's a relatively new one. It was specifically developed for kind of the benefits of the graft and the benefits of like healing a graft and kind of the the kind of, you know, the semi-mucosal tissue. I couldn't say that word. The semi-mucosal tissue of the kind of smaller intestine, and is utilized very similarly to that of a kind of bowel vaginoplasty, which we'll go into in a little bit of a minute. But yeah, the first one is the jejunum vaginoplasty. Okay, so next up is a peritoneal vaginoplasty, most commonly referred to as a peritoneal pull-through vaginoplasty, or PPT. And a peritoneal vaginoplasty utilizes a segment of the kind of lining of your abdomen, essentially. So the peritoneum is the lining of your inner abdomen. It's almost like a sack, I guess. And so what happens is your surgeon goes in and they take a graft of your skin, the peritoneal skin, and they utilize that to make the neovaginal canal in between the bladder and the rectum. And so the peritoneum pull-through technique was specifically developed in the 70s and 80s for women who were born without neovaginal canals, but it's been commonly used within the trans community for many, many years, and it's quite popular. If I personally had had more choice about whether or not I had penile inversion or peritoneal pull-through, I probably would have gone for peritoneal pull-through, just for the kind of, essentially it kind of mitigates the fact that, you know, if you have insufficient tissue, if you were circumcised before your surgery, it really helps to kind of, you know, the graft alleviates all of those issues, alleviates any of that problem. And it's not as mucosal as like a colon vaginoplasty, which we'll talk about in just a minute. So yeah, I would say peritoneal pull-through is probably where we're moving towards more kind of generally as a kind of trans community. But in terms of the kind of PPT technique, it can also be utilized for a surgical revision. So one day I would like to have my neovagina kind of revised just for the kind of loss of depth, which I mentioned in my 5 years post-op video. And so it can be utilized as a revision for some people. Some people specifically go for, you know, the PPT technique because it can produce some amount of lubrication because it's all mucosal skin. However, this isn't respondent to kind of sexual stimulation or anything like that, and it kind of more closely resembles kind of standard vaginal discharge. But there's some really interesting advancements happening with peritoneal pull-through technique at the moment, and I would genuinely say, if it's available to you, I would say definitely explore the idea of a peritoneal vaginoplasty, 100%. Okay, so next up is a bowel vaginoplasty, sometimes referred to as a colonovaginoplasty. So a bowel vaginoplasty specifically, I mean, you can tell from the name, it utilizes a segment of the bowel, a segment of the colon, to create the neovaginal canal between the bladder and the rectum. And this is often used it's not used very commonly in the United Kingdom. You can't get it in the United Kingdom. It's very common in Europe, specifically in Europe, and quite common in America as well. And this has many benefits that kind of penile inversion technique does not have. So utilizing a section of the colon means that the internal kind of the vagina, the internal neovaginal canal, it doesn't require dilation when you're recovering, so you don't need to dilate while you're healing. It also is mucosal, so it can be self-lubricating. There are some complications in terms of like odor and things like that. You have to be clean, you have to be really on top of your hygiene. Obviously you can develop some kind of issues where the graft kind of meets the skin and things like that. But I know some people who've had a colonovaginoplasty and have had perfect experiences, and I know some people who've had a colonovaginoplasty and not had brilliant experiences. But in terms of having like a colon vaginoplasty, bowel vaginoplasty, it kind of mitigates the stress of having dilation, having to dilate after your surgery, but it comes with its own kind of set of different things. I never wanted a bowel vaginoplasty. I never really investigated a bowel vaginoplasty because I have a friend who had it and specifically like secreted quite a specific odor, and it just wasn't for me. It wasn't my vibe, it wasn't my choice, I didn't want it. So yeah, it wasn't for me, but for some people it works great, and some people really, really like it. And it also, it then mitigates the idea of, if someone is circumcised, if someone has a smaller penis to begin with, if someone has issues with their tissue or damage or things like that, it mitigates all of the issues kind of around the kind of penile inversion technique. So that is a bowel vaginoplasty. Okay, and finally, I wanted to talk about a penile inversion technique vaginoplasty, or a PIT vaginoplasty. This is the surgery I had. This is the surgery that I had. For anyone in the comments section who doesn't know what I had a penile inversion technique vaginoplasty, which is where they turn your dick inside out so that my insides match my outsides, because I've always been a knob. But on a more serious note, a penile inversion technique is probably the most common vaginoplasty that is operated on. So the way that a penile inversion technique is kind of utilised is, what happens is they take the skin from the shaft of the penis, and rather than removing that skin, they utilise it to create a vaginal canal in between the bladder and the rectum. So they create a canal, they invert the penile skin into a kind of long, kind of almost like sausage casing, kind of tubing type of thing, and they invert it inside of yourself. And if you have kind of reduced tissue and things like that, you can also have a scrotal graft using some of your scrotal skin if they want to create like a depth and things like that. The problem with having kind of PIT technique is obviously all of the hair follicles have to be cauterized before it's inverted inside of you, so you have to go through electrolysis. The skin is not as stretchy, so it requires dilation. It's not self-lubricating, so you have to use a water-based lubricant when you have sex and things like that. And then they utilize, so because the urethra is shortened, because obviously when you have a penis, you have a longer urethra, like a straw made of flesh. They shorten it, they cut it open, they utilize that skin, and they utilize the scrotal skin, and they use both of those in kind of different techniques, different kind of stitching patterns to create the mons pubis, the labia minora, the labia majora, clitoral hood. The glands of the penis head are kind of relocated to create the clitoris at the top. And so I also had a comment that was like, oh yeah, but you don't pee from your vaginal canal. So just for everyone who doesn't know, the way that a vagina is structured, and it's the same with a neovagina, is you've got the clitoris at the top, the urethra in the middle towards the top, and then the neovaginal canal at the bottom, and then lower from that at the end of your vagina, maybe about an inch or two away, you've got your butthole. So that's how a vagina is structured, that's how a neovagina is structured. So for anyone who doesn't know, you do not urinate through the opening of a neovagina, you urinate through the urethra, just like in a normal vagina. So just to kind of clear that up. It's very much, as I said, the most common surgery in terms of a vaginoplasty is the penile inversion technique. You do have to dilate, and your result in terms of like your resulting depth and your resulting width is very much dependent on what you had to work with prior to surgery. So if you're going into surgery and you're circumcised, you're going into surgery and you're smaller, then often what happens is they will utilize a kind of scrotal graft. In the UK, kind of penile inversion technique vaginoplasty is the only one that's available, other than currently there's some developments with PPT, so peritoneal pull through. But for a colon vaginoplasty, you'd have to go elsewhere, unless it was a very specific, like one-off case. But that's the surgery that I had. I had my penis inverted, and I had some issues with that, and it comes with various different issues, but it's the one that's kind of most common, it's the one that's most used, it's the one that's most researched, and it's been around for years and years and years. So a penile inversion technique vaginoplasty is like older than a certain president that we will not name. It is much older than a Free Berlin. It is much older than, like, vaginoplasties have been long. They've been here a while. They've been here a while. They are not new surgeries. They're only new because they're currently in, like, the kind of rhetoric of trans issues and things like that. But they have been around. I mean, they're like almost 80 years old. So they're not new. They are definitely not new. So sorry. So sorry. Okay, so that is a very quick kind of layman's breakdown of all of the different lower feminizing surgical techniques that are available to people who want to go through a more kind of either androgynous, but usually more feminine genitalia. They want to remove their penis, they want to remove their testicles. Obviously all vaginoplasties include, you know, an orchiectomy, and all vulvoplasties and and you can do them in different stages. You can go to different places to have them done. You can have different parts of your body grafted to create your vaginal canal. You can have no vaginal canal. You can keep your penis and get rid of your testicles. You can do whatever you like. Do whatever you like. It's your body. You've got the body autonomy. But I just wanted to make a video about the different ones that are available to people, because there seems to be a huge amount of like lack of information about the fact that there are multiple different things available to people. And I also just want to reiterate, and I want to say, like, you know, straight off the bat, these surgeries have an exceptionally high success and satisfaction rate. The success and satisfaction rate obviously varies from medical practice, and people publish different things and and obviously lots of people kind of self-refer to whether or not they're happy with what they've got and all of those things. But the satisfaction rate for lower feminizing surgery sits anywhere between 90 to 100% satisfaction across all medical journals, across all research. Everyone who's ever done a research study into the satisfaction of lower feminizing surgery, right? 90 to 100% of people will agree that they are happy with their new, more feminine genitals. Okay? That's a higher percentage rate than, I don't know, like literally everything. I know something I find hysterical is having lower feminizing surgery has a higher, like, a higher satisfaction rate than like marriage, or I don't know, having your teeth pulled is another fun one. But the one I find hilarious is having lower feminizing surgery has a higher satisfaction rate and a lower regret rate than having children. Than giving birth, which I think is hilarious. So if you're in your, you know, if you're ever in two minds about having a child, just get a vagina installed instead. You'll be much happier. Don't worry about it, you'll be fine. So I hope that you learn a little bit today about the different types of lower feminizing surgery that are available to people. I hope you finally learn which surgery I've had, which was, say it with me, the penile inversion technique vaginoplasty. And we know that because we learned it together. The more you know, G.I. Joe. And I will see you next week for another video. Bye, my lovelies. Vaginas.